Okay, so we are going to finish up chapter 1. We had to go over preventative measures, um, and those consist of the primary, secondary, and tertiary preventions. We already talked about health assessment a little bit, and some of the tools that we're going to be looking at. So the 6 facets, and your EdPi and your old cart. We have not gotten to the page in the Python. We'll hit that in a minute. All right, so starting from where we left off, preventative care. Preventative care is just as important. And when we're looking at patients, we are trying to figure out, one, what's their overall status? How can we create influence? How can we help take the status of this patient and make it a little bit better? So again, back to health promotion. That status allows you to make your nursing care plan and to work with the individual patient to create health promotion in their life so that they are leading a little bit healthier lifestyle. And of course to help treat any issues that they might have that you complain. Alright, so let's talk about preventative care. So we have primary, secondary, and tertiary. Primary. And this was a little confusing to me at first, but primary care, you're looking at immunization, health education, risk factors that they might have, accident prevention, and provision housing. Okay, that's what threw me off. So provision housing. The text refers to provision or provisions of, but what they really mean is service of. So what's your house like? Are you getting all your shots? Do you know what's important? What a healthy diet is like? Do you know what type of medicine you need to be taking? Are you wearing your seatbelt? Are you wearing a hard hat at work? Do you have non-slip floors? Things like that. That's primary. Okay. So when we're thinking primary, it pretty much stays within the limits of our house. Okay. So what inside of my personal life without anything else so much. What do I have going on in my house? So I have primary preventions. Again, a safe house, fall prevention. I'm wearing my seatbelt. I'm getting my shots. I'm getting my flu shots. It's primary. Okay. Secondary, it has to do with screening, early treatment, self-exam, and you can handle minor issues. So the way I'm thinking about this one is Walgreens. All right, so at Walgreens, there's our little building. Walgreens is one of my favorite stores. So you notice I don't like going to Walmart. But anyways, here's Walgreens. All right, so at Walgreens you can get medications for small issues. You can even get screening. A lot of times they have screening over at Walgreens where you can get screened for certain issues. It focuses also on disease control, STDs, things of that nature. Walgreens doesn't help with that. But screening, early treatment, self-examination. So are you doing, breast examinations? Are you doing testicular examinations at home? So secondary is a step up from your primary, okay? Primary is in the home pretty much. Secondary is, hey, I'm going to get my eyes screened. I'm going to get my glucose checked. I'm going to go to Walgreens to get my blood pressure checked, whatever the case may be. All right, tertiary. Here's where I start thinking of hospitals. I start thinking of rehab centers, things like that. So you went from your house, you got some medication at Walgreens. That didn't help. Now you're going on to that tertiary part. All right, so in the tertiary part, we have got, you're talking about rehabs, and here's I have a horrible glare on that side. All right, so you're talking about rehabs. Here's my hospital. You're talking about not just about healthcare, but also rehab, people getting back to work. So you're at home, you fell, you broke your hip, you didn't want to go check it out, but you went and got some, Tylenol instead, realized that wasn't the issue, you went to that tertiary, now you're getting sent to the hospital and you're being rehabbed, but you still can't walk all the way. Can we get you back in the workforce? That falls into the tertiary. And again, here we talk about housing, like your personal house, And in the tertiary, we're talking about sheltered communities, provisions of the hospital, services of the hospital. So if I can't get rehab at my local hospital, maybe I can go to the next hospital. Home, Walgreens Hospital. Right, these are kind of step ups as you go through, okay? So throughout this entire process, the nurse has specific roles and responsibilities that have to do with this entire huge health assessment process and all. Okay, so the nurse has specific things that she's supposed to be doing, or he's depending on. All right, so here's my nurse. Yay! She doesn't have a hat, just a big cross on her forehead. All right, so there's my nurse. Her role during this entire process, and that's important. She's supposed to collect. All right, think about this as almost like you're doing an interrogation, CIS. You are collecting data. You're watching. You're critically watching and observing the patient. You're talking about the whole patient. Back to those 6 facets. All right, do I have my spiritual component, my cultural, my developmental, my physical, emotional, all the aspects of the patient, all right, holistic care, and detecting changes, which again is important. So if my patient's one way today, doesn't necessarily mean it'll be the same way tomorrow. So that is your role as a nurse. Now, role is one thing. This is, hey, this is what I'm doing. This is how I'm involved in this entire process. All right. Responsibilities. That's, hey, this is exactly what I am supposed to do as outlined by my job description. These are what I'm responsible for as a nurse. All right. I am responsible for educating. I need to educate my patients. I need to set goals. And again, goals have to do with the patient. They should be included in that. Health promotion. What am I doing for health promotion? A delivery across the lifespan. So from the time that you're 20 to the time that you're 50, delivery across the lifespan, and prevention. All right. So how can I help prevent things? Also, and I should hit on this. In the tertiary, you have immobility and prevention of skin breakdown under the tertiary. All right, so that's part of that tertiary. Just remember that. So we've got roles and responsibilities, and then all these different ways. These are preventative ways. So a nurse might look at this and determine the person could use a primary or secondary preventative measure. That's not going to complete the entire assessment. It's just one little part of preventing issues with the patient. Okay, and that is going to sum up chapter 1. And we'll go into chapter 2.